Good evening. I'm going to present colorectal cancer risk factors in this Colon Cancer Awareness Month of March. First of all, I'm just going to discuss a little bit of epidemiology related to colon cancer. It is the third most common cancer worldwide, and the third most common cancer in males, and the second most common in women. There's approximately 150,000 new cases in the US per year, and this is slowly increasing. Approximately 53,000 patients die from colorectal cancer each year, and it contributes to approximately 8% of all cancer deaths. In the United States, the lifetime risk of colon cancer is approximately 4%. Colon and rectal cancer is approximately 25% higher in men than women, and there is disparity in African Americans and Latinos with a 20% higher risk than whites. And it's shifting towards more right-sided colon cancers. I'm just going to briefly talk about the risk factors and then I'll go through each one individually. Low socioeconomic status increases the risk of colon cancer, most likely through modifiable risk factors. A big component of this is physical inactivity, unhealthy diet, smoking. Obesity increases the risk factors, and I'm going to go through each of these individually. Alcohol consumption, hyperlipidemia, hypertension, high blood pressure, metabolic syndrome associated with diabetes, inflammatory bowel conditions, which can include both ulcerative colitis and Crohn's disease, and chronic kidney disease. Low socioeconomic status also contributes to low rates of screening for colon cancer, and sporadic colon and rectal cancer. The age is a major risk factor for non-associated genetic colorectal cancer. Large bowel cancer is uncommon before age 40, but the increasing incidence is significant between 40 to 50, and this is a slide demonstrating the rates per 100,000, and as you can see, as you go up in age, your risk increases. I am now going to discuss the individual risk factors. Obesity is being demonstrated to be a risk factor for colorectal cancer. 13 studies report that weight gain in early adulthood and midlife increases the risk, with approximately 1.2 times higher than the general population. Obesity also increases the risk of dying from colorectal cancer. Interestingly enough, if patients undergo bariatric surgery, their risk returns to the general population level in 5 to 6 years after surgery. Diabetes has been demonstrated to increase the risk of colon cancer approximately 38% higher than non-diabetics. And rectal cancer was also increased in this group of patients, which are both non-insulin dependent and insulin dependent diabetes. Explanation related to the increased risk may involve insulin as a growth factor for colonic mucosal cells and stimulate colonic tumor cells. Type 2 diabetes also has a specific higher mortality relative to those without diabetes. I often get asked whether red and processed meat increase the risk of colorectal cancer, and the data is not entirely consistent. There is evidence that long-term consumption of red meat or processed meat appear to be associated with an increased risk of colorectal cancer. This is more evident and consistent with left-sided cancers. High temperature cooking, barbecue and pan frying, perhaps by the production of hydrocarbons and other carcinogenic products produced from the proteins in the charring process, potentially increase the risk of colorectal cancer. In 2015, the World Health Organization classified processed meats as carcinogenic to humans and consumption of red meat as a probable carcinogen. They demonstrated that 50 grams of processed meat per day increased the risk of colon cancer by 16%, and 100 grams of red meat consumption per day increased the risk of colorectal cancer by 12%. Interestingly enough, group 1 carcinogens are in the same group as asbestos, cigarettes, and alcohol. Importantly, these observational studies and these conclusions were not consistent in the Women's Health Initiative data analysis, which was 50,000 women followed in an observational study. Tobacco smoking increases the incidence and mortality from colorectal cancer. Colorectal cancer is increased among cigarette smokers compared with those who have never smoked by over 20%, and the risk from dying of colorectal cancer is also increased by 25% in smokers. Cigarette smoking is also a risk factor for all types of colonic polyps. Alcohol consumption of 2 to 3 drinks per day increases the risk by 20%, and heavy drinking, which is greater than or equal to 4 drinks per day, increase the risk by 50%. Light drinkers, 1 drink per day, the relative risk is similar to the normal population. This has been hypothesized that the elevated risk may be associated with interference of the absorption of folate, and excessive alcohol consumption complicates treatment and outcomes in general for all oncological diagnoses. So I'm going to talk in the end a little bit about protective factors. Protective factors are as follows. Physical activity has been demonstrated to decrease the risk of proximal colon cancers when compared to least active individuals, and then around 25% reduction in distal colon cancers. Diet, high in fruits and vegetables. There is some disparity in the data related to this, and the Women's Health Initiative data analysis did not demonstrate a significant association. Vegetarians' dietary patterns have also been associated with decreased risk of colorectal cancer. As colorectal surgeons, we often increase patients' fiber intake, and there is mixed evidence related to fiber consumption in the randomized studies. This may be related to the type of fiber patients are consuming over the world and the adherence to the fiber consumption. Other factors such as calcium, dairy products, and vitamin D. Increasing calcium may be protective, and it has been demonstrated that it prevents recurrence of colorectal adenomas. Dairy products and analysis have mixed results, but it has been demonstrated that low vitamin D levels were associated with high risk of colorectal cancer, up to 30%. Other factors that you may read about: fish consumption is conflicting data if that's protective. Coffee intake also. Some studies demonstrate a decreased risk. There doesn't appear to be an increased risk with coffee intake or fish consumption, and garlic intake is a probable protective factor. Often patients will ask about aspirin and Nsaids, as this is a relatively common question, and there does appear to be an association with protection against the development of colonic adenomas, which are the precursor to colonic adenocarcinoma, and the benefits of aspirin use of 3 or more times a week were associated with decreased risk of all-cause mortality. The bottom line in looking at colorectal risk factors and associations are to increase balanced diet, physical activity, decrease smoking and alcohol intake, and lead